muffled quality, something like the sound of Cochin Hanifa. So when you are speaking like this, the tongue is so high up. If palate goes up, the voice starts opening up tremendously. So many speech pathologists use lot of technique to teach how to lift up the palate. All the other three organs are relatively easy: lip, teeth, and tongue. But palate is not that easy. But again, listen. I am just going to produce a normal now. To lift up the tongue, lift up the palate, there are a lot of techniques. One technique will be just ask the patient to take a yawning. Okay, I'm very sorry, I'm intruding into your topic. Now, if somebody is asking the patient to lift up the palate by, imagine you are going to yawn. So, the voice all of a sudden becomes so open. So the vertical height between the dorsum of the tongue and palate is so important. Many patients actually don't know. Now we go on to the age and voice. You know that the neonate has got the highest pitch because short vocal cord, very thin vocal cord, and it's roughly around 550 hertz. You can see that the neonatal larynx, very prominent direct node, very practically no area below the cord and short vocal cord. When the children grow up, the pitch comes down. Roughly at 8 years, the pitch will be around 370, not 378, I think that's around 370. Not much difference between the male and female. Now in adolescence, something dramatic happens. Under the influence of the hormones, the larynx become very thick, very elongated. This is original infantile larynx, it becomes prolonged. It becomes elongated with the result that there is a Adam's apple, the vocal cord elongates, the pitch drops, the vocal cord becomes thicker, again pitch drops. And if you look anteriorly again, if the infantile larynx looks something like that, it all of a sudden becomes far more prominent adult larynx. This is especially in male, female, that pitch drop is not very significant. What happens in old age? Now, it doesn't mean, I just put it up because it doesn't mean that they had a problem. But if you watch, perimenopausally, many times ladies start dropping their pitch. This is actually a naughtiness of the nature when the males want their pitch to be low and when females want their pitch to be high. After the age of 45 or 50, the male pitch goes up, female pitch comes down. And if you listen, if you remember, towards the end of her career, Srimati Tivila had a very low pitch voice. It need not affect everybody. That is partly because of the deposition and water retention, and the vocal cord become very thick, the muscles become lax, and the pitch can become very low. Now, sex hormones and voice. This is currently a newer topic. We are getting more and more input from more patients. This is one patient who had a testicular atrophy at young age. So he doesn't have, both his testes are damaged. He's now an 18-year-old boy and he has got a different type of voice.
1, 2,
it's almost like a hyperphonia,
4,
but it is still
5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9.
So in Mughal ages, there was a technique called actually to create good singers, loud, sweet voice. There was a technique of selecting young boys and castrating them. So they won't have maybe having testosterone, but they will have other normal problems. They will actually have a very sweet voice. This same thing happens. His growth hormone is normal, but his testosterone levels are abnormal. So he has got something similar to an incomplete mutation. It's not exactly a hyperphonia. It's not a very high pitch voice. It is very pleasing to hear. And this was one technique once practiced in medieval India for selected potential future singers. Why? This is even worse. This is a young boy who had not only hypogonadism but also less growth hormone, normal growth hormone. This child was diagnosed to have this problem at the age of 8 years by the endocrinologist. Unfortunately, the parents didn't take treatment, and now he comes back at the age of 18 years, where I don't think they can do much. But listen to the voice. So this is hypogonadism plus growth hormone retardation. He's 18 years old. Same age. You can watch his body. Finally, you know that this is a very, very key area now. Again, now there's a well-known entity called premenstrual voice syndrome, which any voice professional will come, they come to us, we actually teach them. While male voice is totally is throughout the month normal or same level, because the testosterone level doesn't move too much. While female hormones, estrogen and progesterone levels change, and consequently there will be always a voice difference between the days. Say a young lady who is having a regular menstrual cycle of 28 days, premenstrual period first 4 days, and maybe the first day of the period they have progesterone higher level and estrogen low level. So on these days, their vocal cord will not be able to produce the high pitch which they are usually used to. This is a very, very important concept. Unless you teach the professional, the singer, you say that, look, you cannot sing the 28 days sing like that. When your progesterone period is very high, if you are trying to sing it, as far as possible, avoid a performance. Even though you are very, you cannot avoid, you cannot cancel a performance. You should try to sing one note below. You won't be able to sing on that day. And because if it tries to produce the same pitch at the same level, the result may be a vocal cord hemorrhage. And of course, there are surgeons, I think Sarah belongs to that too. There are surgeons who don't want to operate, don't want to do microlaryngeal surgery when the progesterone level is high. Is that right, sir? So there are a lot of surgeons who say that, if that is the importance, then that is the time, that is the phase of the menstrual cycle, it is better not to operate because the chance of bleeding may be, edema is maybe more, the healing may be less. So that it's a huge topic in voice disorders. I again want to reiterate that when we went for one of the World Voice Conference, all the new things, there were a lot of new things happening. The surgical things happening were very minimal. They were making the older intern surgery more precise, more better, that kind of thing. But the real expert was understanding the voice. How is the voice produced? What is the physiology of the voice and how can you correct? So voice is not a thing produced just by the vocal cord, but from from head to foot. Even the posture in which you stay, if you are very stiff, both your legs are very stiff, then that is going to affect your quality of the voice. This I many times tell the reality of what is happening. So it is ever enlarging field, ever challenging field. Probably it will continue more, and probably in the future we will have just not vocal cord surgery, but also resonance changing surgery. Thanks for the patience.
Thank you, Dr. Jayakumar, for an excellent presentation. If there are any queries or clarifications, Dr. Jayakumar will be too happy to answer. No. Thank you once again.
Thank you, sir. That's the last talk. We now request Dr. Gopal Krishnan, Senior Consultant, ENT Surgeon, Manjeri, to hand over a memento to Dr. Jayakumar as a token of a love and appreciation. Please, sir. May I also request Dr. Moini Kuti, retired professor, Department of ENT, Medical College, Calicut, to hand over mementos to our chairpersons as a token of a love and appreciation. Please, sir.
Jayama, can I ask one question before you go? Jayama, can I answer one question? No, right?
Hello.
Is there any occupational voice hazard for an ENT surgeon? Because we always shift position when we are seeing the patients. I think one of the talks you have said, turning the head to one side and speaking. Is that a problem which can generate a voice disorder?
It may not create a voice disorder, but unless you are in a voice professional who has got such a fine art performing. But continuously using mobile phone or any phone, actually what we are having is a tilting the neck to the one or very rarely you will see a person on the screen. I think you hardly anybody does that. Everybody does. So if you are continuously tailing the head to one particular side, the larynx move away from the neutral position. You know that any organ, the beauty lies in the symmetry and the neutral position. If it is in the neutral position, it has got a maximum time both ways. So if the larynx is no exception, so if the larynx is always tilted to one particular side, the neck muscle on one particular side act more, then naturally its performance will not be there. But for an ENT surgeon or a doctor who doesn't have that kind of a singing ability, that may not be very significant. For a singer, that may not be.
So isn't it unscientific for female participants in reality shows who are the various phases of the menstrual cycle to judge them?
Yeah, I have told it. I raised that issue everywhere I go. I told that is blatantly unfair to compare male voice to female voice. I think except Amrita, I don't know again. I don't even Amrita changes. Everybody has changed, Asian has changed, they have got now 2 winners, both male and female. So there is no comparison. It shouldn't be done.
Even that can be a problem because the menstrual cycle of each female is different.
But that they have done.
Now, we move on to the inauguration of the Boys Club. May I request Dr. K. Ramachandran, Head of the Department of ENT, Medical College, Calicut, and Dr. P.M. Nambudri, Professor, Medical College, Calicut, to accompany our chief guest of the day, Professor Kaidappan Damodaran Nambudri, to the dais. May I also request Dr. P.M. Nambudri to accompany the other dignitaries of the day. Dr. Sudhindra Ghosh, Principal, Medical College, Calicut,